Hello everyone, welcome back to our channel, Your Health Our Concern. On this section, we'll be talking about the vaccines and the negative effects when you are not vaccinated. If you missed our first video, you can check the link below. From Charity and from Eunice are here to tell us the vaccines that we need to know. But we'll first begin with from Charity.
Hello, everyone. So today we are going to be talking about hepatitis B vaccine and rotavirus vaccine. But first, I would like to introduce the word hepatitis. I'm sure it doesn't sound strange to you. It's something you may have heard before. The word hepatitis means inflammation of the liver. And this inflammation occurs when there's actually a damage or an injury in the liver tissues. This damage or injury may cause liver damage or subsequently even more serious illnesses of the liver, including cancer, sepsis, and death. So there are different types of hepatitis. The most common ones are hepatitis A, hepatitis B, hepatitis C. But there are actually uncommon ones like hepatitis D, hepatitis E, autoimmune hepatitis, and also alcoholic hepatitis. Our next question should be, who should get vaccinated? All infants should be vaccinated immediately after birth. All children and adolescents aged to 19 years old should be vaccinated. Adults aged 19 to 59 years should be vaccinated. Elderly 60 years and above who are at risk of developing these infections or even injuries to their liver should be vaccinated. All infants should be vaccinated immediately after birth. That we call at 0 months. Other dosing should follow 1 to 2 months after the first dosing, and also the third dosing should be given 6 months after the first dosing. The importance of giving your child this hepatitis B vaccination is to help prevent the child from further serious illnesses such as liver damage. Another importance we should note is to help prevent other people around this child to avoid getting these infections, because infants or children show no symptoms when they are positive with hepatitis. This disease may be passed from one infant to another person without you even noticing. You should note that hepatitis B vaccines are safe and effective. This vaccine is safe for pregnant women, but please consult your gynecologist for more information. Vaccines, like other medicines, have side effects, but these side effects are mild and usually go on their own. These mild side effects include soreness to the injection site and mild fever. To reduce this soreness at the site of injection, please use a cool, damp cloth. To reduce the mild fever, you could give your child paracetamol, or you could tip a sponge your child after the vaccination. Hepatitis A and B are the only forms of hepatitis that one could get vaccinated from. Hepatitis A and B actually have a combo vaccine which one could take and be immune against both hepatitis A and hepatitis B. But this combo vaccine is only recommended for 18 years and older, and is usually taken in 3 doses. Month 1 is referred to as 0, and the second dose is taken 1 month after the first dose. The last dose is given 6 months after the first dose. If you wish to take a booster dose for hepatitis B, you could visit the nearest primary health care center around you. This booster dose is equally very safe and also help to improve your immunity against this virus. Please note that the only people who shouldn't take these vaccines are those with serious allergy reactions after the first shot. Your status of hepatitis B should be confirmed first before the use of these vaccines. Why? Because the vaccine may worsen your condition if you're positive.
Thank you from Charity on the keynote of hepatitis B vaccine. From Eunice, I would love to know more about rotavirus vaccine.
Rotavirus is a double-stranded RNA virus that causes diarrhea, vomiting, and other intestinal symptoms in children and infants. And it is very, very contagious. It can be contacted through the fecal-oral route. It can also be contacted by touching contaminated surfaces. Rotavirus vaccine is a live attenuated vaccine that is administered orally, and it can be administered in 2 doses or in 3 doses depending on the vaccine. Rotavirus vaccine or R1 vaccine, is given at the 8th week of life and a month later after the initial administration. The second vaccine type is the R5 vaccine or the Rotatec vaccine, and this is given in 3 doses. The first dose is given at the 8th week of life, the second dose is given a month after the initial dose, and the third dose is given at least more than 1 month after the second dose is administered. There are exceptions to the use of these vaccines. Babies that have not been administered any vaccine until their 15th week of life should not be given the vaccine. And again, babies that are not administered the second dose after their initial administration and they are up to 24 weeks of life should not be administered the vaccine again. Some babies as well, they react to initial administration. This can come in form of an anaphylactic reaction. In such cases, it is advisable that you don't administer the vaccine to such babies anymore. What are the negative effects associated with rotavirus? Rotavirus usually show no symptoms within the first 2 days after infection in the system. But when symptoms are manifested, fever, vomiting, and intestinal or abdominal pain is usually experienced. And in most cases, these symptoms disappear or fade away on their own. So it's usually not easy to associate these symptoms with rotavirus because they are peculiar symptoms with almost every illness. The funny thing is that 3 days or more after the symptoms have disappeared, the child can come down again with diarrhea. And when you come to think about it still, we will not want to relate the previous symptoms with the diarrhea that the child is already experiencing. So in most cases, we might feel that, oh, the child is coming up again with another medical condition, which is actually a sign of rotavirus. Diarrhea is severe, sporadic, and dehydrating as the virus works its way through the child's system. It lasts between 5 to 7 days within the system, and during this period, there is severe loss of electrolytes as well. Now, after these symptoms have diminished, the virus can still last in the system for up to 10 days, during which period still the, the virus can still be transmitted to someone that comes in contact with you. We should also remember that after 24 weeks of life, it is usually not necessary to administer rotavirus vaccine to our children. The reason is that within this period of life, it is usually expected that a child is exposed to the rotavirus itself, and so they must have developed immunity against the virus.
Thank you, Fam Eunice, for this enlightenment on rotavirus vaccine. I've learned so much today. What about you? You can comment, like, share, and subscribe to our channel for more interesting health talk.
Stay tuned to our next video where we'll be discussing about vaccines for polio, measles, mumps, and rubella. And also take note that World Hepatitis B Day will be celebrated in July 28th.
You can also reach us on www.asepharmacy.com or call 09034553795. Thank you for listening. I still remain patient from Asep Pharmacy. Bye.
Bye.